Thank you for rejoining us. I'm Paul Chartier. This is Heart of Gold. We have on a couple guys from Avol that are here in Lexington. They'll explain what that is. Mark Royce and Brian Slate. Thank you for joining us.
Thanks for having me.
Thank you, Paul.
Mark, you're the Avol guru.
I am.
You've been there how long?
I have been with the organization a little over 4 years now.
And tell people what Avol is, what's it stand for, and you've got an anniversary coming up.
We do. Avol is AIDS Volunteers Incorporated. We started 25 years ago. It started as a group of friends around a kitchen table trying to decide how they were going to respond to the AIDS epidemic that had come home to Lexington. And now we serve over 400 clients in 72 counties in central and eastern Kentucky. And we provide housing and supportive services for people living with HIV/AIDS, and we also do HIV prevention education and outreach in at-risk communities throughout central and eastern Kentucky.
And Brian, what's your role with Avol?
My title is Resource Coordinator and also Volunteer Coordinator, working with development and event planning and the volunteer program.
And you've got an anniversary coming up.
We do.
Is there a celebration that you got?
We actually, our anniversary was we had our recognition ceremony in September.
Okay.
And October, the end of October was our actual 25th anniversary date.
And some of the fun stuff you did was what?
Well, we got a group of amazing speakers together at the Kentucky Theater to sort of talk about where we've been, where we've come from. We had people who were involved in the first AIDS walk in the early 90s. We had a representative from the governor's office, from the state HIV/AIDS branch. We had Renee Shaw from PBS was with us. It was a great lineup of speakers.
And in the world of Avol, I know that there's a great story to tell. You brought a video with you.
Did.
And may we go to the video and then we'll come back and
Sure.
follow up on that topic. So we're going to go to the video, enjoy it, and we'll be right back.
Face of HIV/AIDS is more familiar than many think. Neighbors, co-workers, family, and friends. Roughly 100 Kentuckians will die from this still prevalent disease this year. Every day in Kentucky, a new person is infected with HIV. The most devastating part? HIV is entirely preventable. For 25 years, AIDS Volunteers Incorporated has been on the front lines of HIV/AIDS in communities throughout central and eastern Kentucky.
My name is Mark Royce. I'm the Executive Director of Avol, which stands for AIDS Volunteers Incorporated. And AIDS Volunteers started as a group of volunteers. Early in the AIDS epidemic, a group of friends got together, sat down around a kitchen table, and said, we've got to take care of our friends who are getting sick and who are dying. And that's how the organization began 25 years ago this year. HIV/AIDS has impacted Lexington and central and eastern Kentucky in pretty dramatic ways. HIV/AIDS follows poverty.
The first step toward defeating this disease is preventing its spread. As a result, Avol has made outreach, prevention awareness, and testing a primary focus in an attempt to stop the disease in its tracks.
When I walked in, I could just look at her because she just had this look on her face, and she was like, I sat down and she was like, well, James, your test came back reactive. Okay, I took a deep breath and everything, and I was like, well, okay, what do we do next? And, ever since then, coming in and now being an actual client and stuff like that, it's just like almost going to the dentist. Anytime that I feel down, depressed, or whatever, I'll either call my care coordinator out here, talk to someone. It's an organization that I now have a group of people who are experiencing the same thing that I'm experiencing. They've gone through it. They know they've tried and tested.
Stigma, poverty, and isolation are daunting challenges for Avol when serving those living with HIV/AIDS in rural areas.
So we're headed to go do testing in a rural area, basically meeting people where they are, meeting the need where it is. A lot of rural communities have high rates because they haven't had access to proper health care. They don't have access to getting into Lexington to do the things that they need to do to keep themselves healthy, so we bring it to them.
Between me and my wife, she had it and I had it, and neither one of us know. People were just scared to even sit in the chair I just sat in. There's been a couple instances where people just really worked me over with it. And it was scary, and I didn't know why. Most of them think I should report it or pack up and leave. I would rather do the latter. I really I like this town, but I can't live the rest of my life looking over my shoulder.
Avol knows that caring for people living with HIV/AIDS means reaching out beyond the walls of a hospital or pharmacy. As a result, Avol seeks to collaborate with communities to stop the spread of HIV/AIDS and to empower those affected.
If you come back with a reactive test, we can connect you to health care. We can connect you to the services that you need. And for some folks who are positive, they will eventually come back to Avol for help and assistance with housing, with supportive services, referrals to substance abuse care, mental health care.
That's all my family. This picture right here is me before I got sick. I'm Donna Taryn. I have had HIV for about 20 years. My late husband was Jekyll and Hyde. Before we were married, he was one person. After we were married, he was a totally different person. Unknown to me, he was an IV drug user. And I lived by myself for about 1.5 years, 2 years, and then I went to a nursing home. My doctor got me into a nursing home. He had got this place started. My doctor did, and he got me to be the first person in here.
Avol is unique in that we operate 2 housing facilities. We have a community-based residence called Solomon House. That house houses 7 people who need assisted living. And then we also have a transitional apartment complex, and that helps people move from a state of homelessness through transition into permanent housing.
And they say that no matter what happens, they will be there for us. And I trust that. I believe they will.
Serving 72 counties, Avol strives tirelessly to provide hope and assistance to those infected and affected by HIV and AIDS in the state of Kentucky.
Avol's biggest challenge going forward is reaching the people we serve, both in prevention and both with folks living with HIV/AIDS. We need funding to help us reach out into the communities that are not being served right now, whether that be through a mobile testing unit, whether that be from establishing volunteer corps in rural communities. We also need assistance in getting our clients to us, and that could be transportation, that could be gas cards. These are all expenses that aren't grant funded at the moment, and so private money is crucial for us to be able to have this outreach.
It's up, they're always there, and they're always will. And that makes me feel a whole lot better about how my future will be later on.
AIDS volunteers collaborating with communities to stop the spread of HIV/AIDS and to empower those infected.
It's quite emotional.
Yeah, it's powerful stuff.
Early on, maybe more than now, very controversial topic. Yeah?
Definitely.
But you know what? Let's put all that aside. And these are human beings. They need help. And you are here to help them. So thank you.
Thanks.
Thank you.
We've got a few minutes left. It is quite costly to drive around Kentucky and meet with these folks. Dining Out for Life is a fun event to help raise some money to do the great things that you do. Who would like to talk about the food part, the fun part?
I'll do that.
Yeah.
Dining Out for Life is, it's become our signature event. And Dining Out for Life was actually started in Philadelphia 22 years ago. And it has spread to over 60 cities across the United States and Canada. We brought it to Lexington 3 years ago. And the way we do it in Lexington is we recruit locally owned restaurants. Everything from, say, a 3rd Street Stuff Coffee House to fine dining like Dudley's and Sal's Chop House and everything in between, Bourbon and Toulouse. And we have 30 restaurants that are participating this year. and they agree to give a percentage of their proceeds for the day. Dining Out for Life this year is November the 28th. It's always the Wednesday after Thanksgiving. And the date changes, but you know, it's always the Wednesday after Thanksgiving. It's an all-day event. There's breakfast, lunch, and dinner. You can just go out to eat, and it just becomes a great event because you're not having to buy a new cocktail dress and get your hair done to go out to, you know, buy tickets to an event. You can just go out to eat. You know, we have pizza delivery, and you can have pizza delivered. You can get coffee on the way to work. You can take the office to lunch. You know, it's just a really neat event.
It should be the day before Lent. Eat all you want to, and then go on the wagon.
Yeah, exactly.
Money-wise, participation-wise, any idea how many participants you have had in this in the past?
We have, I think our average is about 1,400 people at least participate. Again, it's 30 restaurants and all day long, and we raise, it's our signature fundraising event. We raise quite a bit of money.
And I would think that that number of restaurants is going to grow, and it's probably your job.
Yeah, that is a little bit of my job. It will grow. I don't think we want to get too many restaurants, because we want the restaurants to benefit from this event as well. You know, it's a win-win situation, not only for the community, but you know, for the people involved and for Avol and the restaurants. And so I think that's one reason the event works as well as it does. And you know, there's different aspects to the whole event where we have hosts, like someone like yourself that can host a restaurant, and they help to generate business that day, whichever meal that they're available for, or they take, you know, friends or family, coworkers out to eat. And then we have ambassadors that are also in the restaurants, and they're there every shift, and we have them dressed in black, and they're trained volunteers just for the event with a red apron with Avol. And we also have a drawing that we've included with multiple prizes. We have set of tires from S&S Tire. There's Woodford Reserve VIP tours. But it's just to say thank you for coming out to support not only our cause, but the restaurant. And everybody is, you know, eligible to enter the drawing, and you know, as well as they can add a donation if they'd like to, because it is a remittance envelope. But there's no obligation, and everybody gets to be in the part of the drawing as well.
So to compassionately work with this segment of our community, what's your website and phone number again, Mark?
Our website is avolky.org. Our phone number is 225-3000. And diningoutforlife.com is the international website, or avolky.org/DOFL.
Gentlemen, thank you for doing this.
Paul, thank you.
Thank you.
We now know about Avol. Let's raise some money and take care of the good guys and women. Thank you.
I appreciate it.
Thanks.
I'm Paul Chartier. This is Heart of Gold. Happy holiday season.